Okay, good morning, everyone. It's 9:03, so we should get started. Welcome to the CMTI Supervisor Learning Collaborative number 4. My name is Ruth Colon-Wagner, and I'm the Senior Project Coordinator with NIAPRS, the New York Association of Psychiatric Rehabilitation Services. Before I continue talking, just please let me apologize. My voice is very raspy, and it hurts like crazy, but I am here, and I'm doing as well as I can, so I hope you can understand me. Before I introduce our wonderful presenters, I just want to take the time while I have everyone's attention to really just tell you about our next activities in this initiative. Following this, this All Supervisor Learning Collaborative call will be our regional report back calls, and Tuesday, November 3rd at 9 is for the Western and Rochester region. Wednesday, November 4th at 9 is for Central, Utica, and Watertown. Friday, November 6th at 9 is for Northeastern and Northern Metro. And then we're going to be skipping December, and we're going to be returning in January, right after the new year, on Tuesday, January 5th, and that's going to be for our 5th and final webinar. And Friday, we're going to come back as a learning collaborative, so all the supervisors will come back for our supervisor call, and then in March, we have our actual last face-to-face in-person session. So we're really in the home stretch, guys, and I just want to thank you all, not just for being here and sticking with us and learning, sharing all your talents with us and all the work that you do. So now what I want to do is, before we begin, I just ask you for another moment while I introduce our esteemed presenters today. I'm going to begin with Paul Margulies. He is a PhD, and he is the Associate Director for Practice Innovation and Implementation at the Center for Practice Innovation. Now, in this position, he oversees implementation and training efforts for a number of initiatives, including this one, that bring best treatment practices to our field. He holds a faculty position in the Department of Psychiatry at Columbia University's College of Physicians and Surgeons. He is a psychologist, and over the course of the past 35-plus years, he's worked in the community and inpatient settings in a variety of clinical, supervisory, and administrative roles. Paul has published articles on evidence-based practices and presented papers and workshops at regional, national, and international conferences. Next, I'd like to introduce Adele Gorgeous. She is the Executive Director of the New York Care Coordination Program. Adele is responsible for overseeing a complex set of programmatic, clinical, regulatory, fiscal, and technical initiatives, sounds very, very complicated, designed to improve services to persons diagnosed with mental illness. In addition to her strong project management capabilities, she brings to the project significant experience in the behavioral health finance field. She has presented on the New York Care Coordination Program in a number of forums, including American Psychiatric Association as well as NIAPRS. Prior to joining CCSI, Adele has served as the Director of Finance for Rochester General Behavioral Health System. She holds a degree in political science. I don't see Christine up there. Is Christine joining us today?
She is. She's here.
So let me introduce Christine Mangione.
You just saw her hand. Yeah.
Christine is a registered nurse and a certified case manager with both managed care and direct care experience with adults and children in emergency inpatient and outpatient settings. She is currently the clinical director for Health Homes of Upstate New York. Recent work with Beacon Health Strategies in partnership with NYCCP include the development and implementation of a complex care management program to better serve high-need and complexity ill individuals. And she was also manager of clinical operations for the Western Region BHO. Christine has spoken at statewide conferences on the subject of health home care management, including ACCLAIM and the New York State Care Management Association, as well as many regional meetings organized by the Western Regional Behavioral Health Organization. Christine is a graduate of Johns Hopkins School of Nursing at the University of Rochester. Finally, we have John Lee.
Did you try that part?
Hi, Christine. Finally, we have John Lee. He is a director of the Center for Collaboration in Community Health. He's worked for both community care behavioral health organizations as well as Beacon Health Strategies, most recently in the role of Program Director for the Western Region Behavioral Health Organization Initiative. In addition, John has served as Vice President for Highland Hospital of Rochester for a number of years. He holds an MBA with a certificate in health administration from Cornell and is currently a member of the New York State Behavioral Health Advisory Council. Now, there are a couple of people you don't see on the screen, and that is Nancy Cabo. She's Associate Director of Implementation Support Systems at the Center for Practice Innovation. And then Diane Neufeld of the New York Care Coordination Program.
Did you get through or no?
So we have some housekeeping issues. Your lines are currently muted. If you have a question, on the top you'll see the little guy with his hand raised. You can click on that, raise your hand, and we will unmute you so that you can ask your question. As we also have our chat box that you also can use. And in this presentation, as in our other Learning Collaborative sessions, we're going to be asking questions via poll, and you'll see that pop up on your screen where you can answer. So Paul, with that, I now pass the mic to you. Thank you all very much.
Actually, I think, is it Adele, are you opening?
Hey, Paul, this is John. Actually, I am opening. So you can pass it to me. Ruth, thanks very much for the introductions. Welcome, everybody. And
well, now I can mute
really
that.
it's going to feel better. I have the pleasure of just going through the topics that will be covered today as we really focus on the role for supervisors in effective health home care management, quality assurance, and outcomes measurement. So topics that we will be covering today include we move forward here. Assessing performance, and really understanding that in assessing performance within health home care management, there is a role for everyone. Supervisors, that's clearly critical in your role, but others also will perform that kind of function. We'll spend some time looking at internal audits, what they look like, why they're so important to continuing to improve our quality of services. We'll look at 4 levels of audits: care management agency level, health home level, the managed care organization level, as well as the state level. And then we'll talk about how you as a supervisor can really incorporate audit processes and data into the supervision of your care managers, all with the intent that if all this works well, we will improve the quality of services and the outcomes for our clients. So just a reminder, in assessing performance, it is everybody's job to monitor performance to ensure that we're providing quality services. And again, think about that fidelity to the model and to make sure that outcomes are being met. Here are just some examples of ways in which various entities that are involved in the management of health home care management will play a role in assessing performance. Again, care management agencies, as we talked about in our earlier webinar, chart audit tools can be really, really helpful. And again, we'll spend some time talking about those tools in just a little bit. At the health home level, there are care management data analysis tools, and one is the CMART. We shared some examples of information that can be obtained through the CMART, reviewed by the health home, hopefully shared with the downstream care management agencies as a vehicle for giving feedback on performance. At the managed care organization level, there are outcome reports being created, oftentimes using HEDIS information, that's healthcare effectiveness data and information set. And then at the state level, we did present information about MAP, which is a Medicaid Analytics Performance Portal that is currently being rolled out as a tool to support the adult population and will be certainly an important part of the rollout of health homes for children. But just as a way of explaining that across the continuum of supports to assure good services in the world of health home care management, everybody does play a role. So what I'd like to do now is turn the presentation over to Chris Mangione, who will talk about internal audits.
There we go. Good morning, everyone, and thanks, John. So, as John said, we're going to talk about internal audits and why they can be useful in the supervision of care managers. One aspect of the supervision, as I just said, is the use of information. Now, external audits provide information that's important and useful about the process of care management and the outcomes. But using an internal audit with the same information, a supervisor can assist care managers as far as driving QI, quality improvement, providing an important focus for supervision. So with an internal audit, opportunities for improvement of skills with a particular care manager can be identified. We can also increase the care manager's understanding of their role in the big picture of health homes and the state initiative of healthcare reform. An internal audit can also ensure that care managers are on the same page as the supervisors, the administrators, and others within their same agency. So if there's a particular quality initiative that this agency has identified, during supervision and with the use of an internal audit, the care manager supervisor can review that particular initiative and explain why it's so important using the data with the care manager.
Okay, thank you, Chris. This is Paul, and good morning, everybody. As Ruth had mentioned, there are really two major parts to today's webinar. One part is presenting information and reviewing information, which we've begun to do. The other part is the interactive part. It's the opportunity to have people share from their own experiences and hopefully for people to learn from each other. So we have a couple of questions that we'd like to ask you to respond to. And the way to respond is by using the chat box, which you'll find at the bottom of your screen. And so there are two questions. The first one is, does your agency currently share any data with your care managers? And if so, please tell us what kinds of data and how it's shared. So if people can please type up using the chat box, that would be most helpful. We'll give you a couple of minutes, and then we'll share what people have typed up. I see multiple attendees are typing, and I always love to see that because that means people are responding and sharing information, so we definitely appreciate that. We'll give you a couple of minutes. While people are typing up, I'll mention that we're going to come back in with various kinds of questions throughout today's webinar, in an attempt to really have people talk about what they're doing and what they're planning to do, and most importantly, for us to learn from one another. Give folks another minute or so. I see some people's responses are beginning to appear, which is wonderful. Look at this, lots of responses. This is great. I'm going to begin to read, and while I'm reading, please feel free to continue to type up, folks. So Laura tells us the GAP report is used. Doug Meyer tells us only end-of-month total interventions via Insight Plus, so the care managers can see their performance against other care managers. And then Molly tells us it's minimal. It comes up sometimes in monthly care managers meetings and where data may be shared. It is unclear about outcome data. Care managers are requesting more data, such as how do I know how I'm doing, making markers and outcomes. So they're asking exactly the right questions, and hopefully by the time we end today's webinar, you'll have a little bit of a sense of some of the data that is or will be available that can be shared. Anna types up, yes, we share the results of the quarterly performance reports that we receive from one of the two health homes we were working with. We also share report data from Insight Plus. Mary types up, yes, survey results, engagement rates, shared verbally and written results. That's terrific. Jessica tells us, each month we complete quality reviews for the charts and individually meet with the care managers to discuss the reviews and the changes that need to be made to ensure the charts are in order. Now that sounds like CQI to me. That's just excellent. See, some other folks are typing up. And so what we're seeing is that there are a number of programs that are using data and using them in somewhat different ways, one program to another. But all, I think, in the service of improving outcomes. See, more people are typing up. Molly writes, I think it is also important to let care managers know that while data is important, it may not reflect the true work they are doing in relationships. Yeah, the reality is data is critically important, but there are other things that is a little bit more difficult to quantify that are also important. And we certainly want to be paying attention to those as well, Molly. You make a good point. Give folks another moment or so as they're typing up. You know, we put this first question in really in a sense to do a little bit of fishing. It was a fishing expedition to see what's currently going on, and what we're seeing very clearly is there's lots going on. You know, as we go forward with the rest of the webinar, we're going to focus in more and more on specific aspects and kinds of data and ask you some focused questions around that. And I see while we're waiting, I see Mary just typing up. I see there was a question that came up earlier from Tom Nettle, and that was where can we readily find the chart audit tool? Is there a response for that?
Yes, well, it's included in the presentation. And it's the complete audit tool, very comprehensive. So Tom, you can find that in the presentation.
Great. Mary Jo is typing up. We also do record record reviews and give feedback to the care managers. The use of engagement rates is very helpful for staff. We try to measure GIC when we have the information from the PCP or insurer. This is not consistent and difficult to measure in today's world. Okay. Shall we move on with more of the presentation? Thank you, everybody, for responding.
Yes, thank you, everybody. So at the agency level, we're now going to just discuss a little bit about how you might use the chart audit tool, what it's useful for. Well, the tool itself, once it's completed, is very useful in comparing your agency outcomes against the state's requirements. It's also helpful to compare health home care manager outcomes within the agency. So you could actually compare individual care managers within your agency, their performance overall and individually, and compare current performance of the agency against previous performance. You could also compare current performance of the care manager against their previous performance, which would allow you to perhaps initiate a quality improvement for each care manager.
Would you like me to? Okay.
Would you like to do the second polling question, Paul?
Or would you like to just review some more of the slides? I was going to offer to actually advance the slides. Do you want to go through the sample and then we can go to the polling question?
Perfect. So here's the sample audit tool. It's on a couple of slides. So this is an audit tool that Health Homes of Upstate New York uses. The agency is listed, the ID of the particular individual whose record is being reviewed, the care manager, the caseload of their care manager. I think we believe that might be helpful in looking at the score and including the caseload that person's carrying, who the reviewer is, the date of the review, and when the individual was enrolled. On the other column, there's the key. So for all of the answers that are responded to with a yes, 1 point is given, a no is 0. We also do give partial credit, and an NA is also given 1 credit. This is the actual tool itself. The first component is initial documentation. Now, my understanding is that the supervisors attended the original presentation, and this was discussed in detail, so I'm not going to go through every question in the audit tool, but I do want to cover the domain. So initial documentation, we look at time frames, quality, and the quality is over a few slides. Just some examples. So we're looking to see that the care plan is really representative of the needs and priorities that the individual identified, and we pull that from the comprehensive assessment. We're looking for person-centered practice, and that the notes that the care manager is documenting really represent the activities that took place for that particular intervention. Again, quality continuing. The care manager notes demonstrate the care manager's efforts in obtaining needed services. So if an individual is not connected with a primary care physician, certainly we'd be looking to see that that particular referral occurred while the person was shortly, actually, once enrollment took place. Then we tally the score, and it's provided to the agency so that they can then share it with the individual care manager. Okay.
So now we come to another polling question. And once again, same process. We're going to use the chat box at the bottom of your screen there. And so the first question is, are you currently bringing chart audit data into your supervision? And if you are, what kinds of data and how is it shared? So if we can ask people to take a couple of minutes and type up and share. We already know from the first set of questions there are some folks who are doing this. So please give us some details. What are you doing? How's it working? Anything other people can benefit from learning about from your own experiences, we'd so appreciate. See, we've got the multiple attendees are typing, which is what we love to see. And we're assuming at this point that some programs, some folks are doing this and some aren't. And even those that are could probably, I would think, benefit from hearing how other folks are doing it. So please be generous, share from your own experiences, and we can all, really learn quite a bit. Glad to see folks are typing up. We've got some answers coming in. And really, while people are typing up, one of the concepts here that we just want to keep driving home is, so, throughout this webinar, we're talking about these external audit processes, these tools and ways in which, data is collected externally. And really what we're suggesting is to take those same tools and those same processes and bring them internally so that supervisors are using them to also uncover data that's shared with their supervisees, with the care managers, is really an extraordinary way to do supervision. And you may remember way back when we began the first set of presentations, I think this is when we were doing the face-to-face first round, we talked about how data can be such an essential aspect of doing supervision. And at that point in time, not a lot of folks were using data, were incorporating data. So it's really music to my ears to see these reports of folks that have begun to do that. Give you another minute or so to type up, and then we'll start reading, folks. I'm just kind of very quickly reading the responses. I see all sorts of different kinds of ways people are doing this. This is good. You know, I'm going to begin reading, and please, if you're typing, continue to type up. I see Tom Nettle asked a question. Can you give an example, please, of how to determine person-centeredness as requested by the chart audit tool? Is that something we can respond to now or separately? Or
I can respond to that now, Paul. I think one example might be if an individual needs a referral or is without a primary care physician, or perhaps if they're interested in changing their primary care physician. If there's documentation that the care manager really tried to elicit what they're looking for, if they're looking for a new primary care physician, are they looking, what about the location? Are they interested in having someone on a bus route? Are they looking for someone who would appreciate their culture, so somebody who is culturally responsive? So we're looking to see that there is an effort to connect this person with a provider of service that they feel is responsive to their needs.
that's great. And the assumption is that there would be some documentation of that, you know, in the charts.
Absolutely.
Terrific. Thank you. Okay, Mary Jo types up, just going back to the question of, so are you doing this stuff? And if so, how? Around chart audits. Mary Jo is telling us yes. We bring the audit sheet into the meeting so that the staff can see exactly where the problem is. We also send out kudos to those who have a great audit and highlight what they've done well, which is so important, you know, to be really reinforcing the good work is so important. Thanks, Mary Jo. Anna types up, yes, we created an internal chart audit, and supervisors do discuss those results in weekly supervision. And she's asking, where can we find the tool just shown?
Well, that tool is an audit tool used by Health Homes of Upstate New York. So it is contained in the slide deck.
Thank you. So, and folks will have the opportunity to download the slides at some point, I assume, so that'll be there. Okay, let's see. Molly types up, we had a system for doing this last year, but it fell apart. We tend to use it when there are charting problems. And so it looks like, you know, from what people are saying, this can be helpful around problems. It also can be helpful, though, to identify strengths and where people are doing well so you can give them the kudos. Nora is saying, just starting, and it will be used in supervision, will be a major part of supervision. Terrific. Doug types up, our health home randomly audits 10 charts per month, and we share the results with the care managers who had their charts audited by the health home. Other than that, we review the care plan, team and assessments in Insight Plus on a large screen with all care managers offering comments on the case under review. 1 chart per care manager per week. That's really, really creative. Thanks for sharing that, Doug. So it really becomes a group learning experience where folks together, you know, can be looking at the same charts. That's great. Mary tells us, yes, our health home completes random chart audits on a quarterly basis. Our agency completes the same chart audit tool that the health home uses. So there's your internal audits, and they complete random audits monthly. This info is shared with the care managers and discussed in supervision. If we see a trend, we conduct a training to address the issue. That's like perfect. Molly tells us our internal audits are done on a regular basis, would like to better utilize the information and give kudos as well to staff that are doing well, support those that are struggling. Great. So we're seeing a theme here, aren't we? Tom tells us we are looking for the presence of facilitating improved health care within the care plan, as well as a plan for every client to transition from the service towards self-management. So that's a particular focus on your audits, it looks like. Guest number 2 tells us we share the review with the specific care manager, and it has worked! Exclamation point. The care managers appear to appreciate the feedback. They want to do well. Terrific. And then Kevin tells us our own audit chart focuses on person-centered principles. Person-centered principles have been focused throughout the agency for years and part of the culture of the agency. New hires are indoctrinated. The audits are used in supervision and case review. Feedback is based on person-centered. Oh, that's wonderful. So if we can pull this down, and I can go to the next slide, please. We have, I believe, another polling question, and that is, so if you're one of the programs that is not yet sharing CHART audit data, how can you begin? And we're assuming some programs haven't begun yet, and that's okay. So let's take a couple of minutes and for folks to type up, how do you want to begin if you haven't done this yet? And please feel free to type up, once again, in the chat box at the bottom of your screen. Is there anything you've heard so far that you want to, borrow as you begin to gear up, or if you're already doing some of this and would like to do more or do differently? Give folks another minute, see if anybody has anything to share. And once again, what we're hoping comes out of this discussion today are people beginning to put together kind of game plans, learning from, what others are sharing, to either start what has not yet begun or add to what has begun. Another minute, see if anybody has anything to type up. We have a care manager focus group that will be working on what information they would like and how to use it. That's great, Molly. That's absolutely perfect. So you're getting input from the very people that, you're working with. Which is kind of, a very logical and a very reasonable thing to do, but it's amazing how often we just don't think to do those kinds of things. So to actually go out of your way to organize a focus group and to get that kind of feedback will be very helpful. Okay, why don't we move along to the next presentation? We've got lots more to talk about.
Okay, thanks, Paul. So just to summarize and maybe add a few things, these are suggestions about how you might utilize the tool, the audit tool in supervision. So provide every care manager with this audit template as a resource. Now for Honey, we do provide this particular audit tool to every agency, a template of it, so that they can use it as a component of their supervision. And during supervision, actually complete an audit with the care manager when you're reviewing one or two of their records during that supervision. And we also encourage peer record review, so having care managers use the audit tool and review each other's record. So I think that wraps it up for using the audit tool in an internal situation. And I'm going to pass this on now to Adele.
Okay, thank you very much. Thank you, Chris. What we're going to look at now is data that is available to you basically from the health home level. So Chris was looking at data that would be generated by your care management agency, perhaps using outside tools. We're now going to look at some data that as a care management agency you contribute to the collection of this data. It gets aggregated and reported back at the health home level. This is something called the Care Management Data Analysis Tool, better known as the CMART. I'm sure you're all familiar with the CMART and have spent many hours being sure you put your information in so that you get information back. This basically collects standardized care management data for all of the members assigned to the health home. It allows you to compare your agency outcomes to state requirements to be sure you're on target. It lets you evaluate the volume and type of interventions that your care managers are actually carrying out. And it lets you look at the impact of care management services on outcomes for the health home enrollees. So, potentially a very useful tool. I'm not seeming to be able to advance this. Oh,
Oh, it's going, here we go.
okay. There we have one. It advanced. Let's, hopefully we can do that again the next time.
I think Hal is advancing that for you.
Okay. This is an example of one type of information that you can get from the CMART. It gives you a count of how many interventions, either by mail, by phone, in person, etc., various numbers of individuals had. For example, 167 individuals for the quarter in question for this particular health home had 0 interventions. And then it goes up to 1,144 had 3 interventions, 205 individuals had 7 interventions. The highest number is 56 individuals with 13 interventions. Gives you an insight into how your care managers are practicing and how many services are actually recorded for those individuals. The next slide, please, from somebody who can actually advance it. Okay, great. Thank you, Chris. This gives you another look at information that you can get from the CMART tool. The top box looks at the number of individuals who received an intervention in the category of care management services. As you may recall, there are 6 core services required for health home care management. Care management is one of those. For this particular agency, for this quarter, 696 had 0 care management services, and 464 had 4 care management services. The next box, it counts the number of interventions for community and social support. Interestingly, 3,624 individuals had 0 interventions. This is one of the anomalies you want to watch for in the CMART data. You can only record one type of care management service per intervention. So clearly in this case, care management is the first one recorded. Community and social support may well have also taken place in the same visit or the same contact, but it doesn't get counted because you can only count the one. But still, interesting information, a lot more indicators than the 3 that I have just gone through. Hopefully you're getting the report on the CMART from the health homes with whom you are contracted and passing that down to your care managers at the supervisory sessions that it appears, at least people on the call today, have pretty good structures for getting the information to their care managers. We can go on to the next slide.
Thank you, Adele.
Paul?
Thank you. So what we're going to do now is we're actually going to combine several questions into one, once again using the chat box. So the first question is, are you currently bringing the CMART data into your supervision with care managers? And if so, second question is, tell us about it and how's it going and give us some details. And then let's add the third question, which is, if not, how do you want to begin? So if folks will take the next couple of minutes and type up into the chat box all of this related to the CMART data. Are you doing it? If so, how? If not, how do you want to get started? And any details that you're comfortable and willing to share, others will benefit from. So we'll give it a couple of minutes and we'll see what people type up. And I see multiple attendees are typing up, so thank you, folks. And while folks are typing up, I see Carla has asked a question, is how do we access our CMART data from the health home? Can anybody respond to that?
I think the health home would have to send that data to you. And if you have the name of a contact person at the health home with which you are contracted, or the multiple health homes that you might be working with, call that individual and let them know that you'd like to have that data for your agency. And health homes are very interested in having great quality. And so I would assume that the health homes would be delighted to send that to you. And
And I'm seeing Tom is typing up the same thing, that at this point he does not get the CMART data. So it looks like in answer to the question of if you're not doing it, how do you get started? The first response is, please get in touch with your health home and see if you can get the data. And it sounds like you will be able to get it. But
anybody who is affiliated with Honey, consider yourselves to have made the request. We will be sure that, in fact, we are getting this information out to you on a regular basis.
Excellent. And for those who are affiliated with other health homes, it sounds like there may be a need for you to proactively reach out and ask for it if you're not already getting it.
And if you don't know who to contact, ask the executive director of the health home. They would know who to pass the request down to so that you actually got the data you're looking for.
We'll give folks another minute to type up, and then we'll read the other responses. And I guess, between the lines, what we're saying is we strongly encourage that you do so. This is very valuable data that can be so helpful as part of your supervision process. Okay, while others are typing up, I'll start to read. Doug has an interesting comment here. The CMART data per se is not shared, but the report function in Insight Plus captures the same information in a much more useful format that is shared with care managers. Insight Plus automatically feeds CMART. Back when we were manually entering CMART data, the care managers were overwhelmed, and any mention of CMART now incites rebellion. So it sounds like, Doug, you found a creative way around the rebellion to make sure people still get access to the important information.
That's totally understandable, Doug.
But I just want to underscore the fact that Doug and folks at his setting have found a way around that issue, so people still get the data. That's the most, bottom line, that's the important thing, that people see the information, and it helps to shape what they're doing. Here's something from Tom, and he begins by saying, perhaps this is a question for another session, but I think it dovetails. What supervision schedules, structures, frequency do you all use with care managers to review data being discussed? So we'll throw that open for people to respond to. At the same time, Mary types up, I am able to see the number of interventions per care manager, but not able to get additional data as shown on the slides, but maybe I just don't know how to access it via Insight. So I don't know if there's anybody can respond to Tom or Mary's questions. Is there any responses?
In terms of accessing it via Insight, I'm assuming that Insight Plus is a care management application that your agency uses. And so you would have to talk to your IT department and ask them if they could write some additional reports to give to you that would give you the full range of the CMART data. But maybe they think that getting all the ones that are really going to be useful to you at this point, but worth checking.
Thanks, Adele. I see people are still typing up. We've got some response here. Doug says, Mary, play with the report function and explore it.
Mary, go meet with Doug. And can I just say that as far as Tom's question regarding supervision schedule, structures, frequency, some health homes, certainly here at Honey, we have quarterly hub meetings to discuss this information. There's an opportunity to present the information and then have a discussion with the care management agencies at that time.
Right. And Mary's going to call Doug. Excellent.
Excellent.
You know, I'm looking at the time, so maybe and I know people are continuing to type up, but maybe we should move on a bit because we do have a fair amount of other information we want to get out to people. And thank you, folks. Continue to type up, and we will circle back to your comments.
Now we're moving on to the type of information that might be available to you through managed care plans. Some managed care plans supply a lot of information. Others really don't supply much information other than a periodic request to review various charts for their enrollees. But to the extent that you get information from the managed care plans, you can use it to compare your agency's outcomes against the state requirements, to compare health home performance against other care management agencies or health home to health home. Regarding outcomes, practices regarding outcome reports vary among managed care plans, some more than others. The following example is actually a report from one MCO that typically comes to monthly meetings with health homes with a rather lengthy report on how you as a health home are doing against their standards. So let's take a look at some of the information available here. This is just one out of multiple pages. What they do is organize, they give you, in the left-hand column, each of the core services, moving in, say, so for care management, and then they give you a process goal for, let's look at care transitions. 90% of patients discharged from emergency departments see a clinician for follow-up with 7 days of discharge. So that's the process goal. And then there's also an outcome goal that would be there's a reduction in emergency room visits. And then they do what is called headlight monitoring and tail light monitoring, hospital alerts or ER discharges for the headlights monitoring, and then follow-up visit completion data at the member level for the tail lights monitoring. So they go through each of the core services and look and tell you what they're going to be looking at and give you the information about how you're doing on the process goals, the outcome goals, and how they're going to be, and then give you the measures for yourself. So that is a fairly robust data set, but of course it's only for the individuals who are enrolled in that particular managed care plan, which is United Healthcare. They have a very clear vision that they put out to the health homes, so you know what it is they're looking to have happen. And they give you the various domains: medical care, behavioral care, social support. This is what they're looking at. And these are the types of things that they review for each of those domains. So,
Thank you, Adele.
thank
So let's go
you.
back to some more polling questions, and it's going to be the same 3 questions, but this time related to the managed care organization level outcomes data. So are you bringing it into supervision with care managers? If you're doing it, how you're doing it, and how's it going? Please give us some details. And if not, what's the first step you can take? So let's give you a couple of minutes. Once again, using the chat box. And please share what you can, folks. And while folks are doing this, I'm just going to pick up on some notes that came in prior. This is in response to the question from Tom of how frequently do you share data with your care managers? And Anna tells us weekly, and discuss data as necessary, probably during most supervisions. There's a case review component in addition to discussing data. We also hold a weekly team meeting, part of which is to discuss shared issues and concerns. Thank you, Anna. And Tom tells us, I haven't seen any outcomes reports yet. Okay, so there are multiple attendees are typing up, so we'll give you another minute or two. I know that we're winding down on time, but I think we certainly can have some time to talk about your responses here. And what we're seeing, 2 out of 2 so far, is we're not getting it. I don't believe we get the MCO level outcomes.
That's great feedback. It means that there is data that might be shared with you that you are not currently getting. And as I said, it's not all the managed care companies, but certainly it would be best practice for health homes to pass this in any information they have about your agency down to you so that you could actually use it to improve practice, understand where your strengths are and where you might do better than currently.
Yes, and Adele, I'm seeing so far every response has been the same. People just aren't getting it.
Okay.
So maybe
there
we can...
is an opportunity for all health homes to give you some additional data that would be very useful for you.
And Molly has an optimistic note here. She says we're just beginning and we'll be getting this data. So good. Okay, maybe we can turn it back to the remainder of the presentation.
Okay. Okay, the last area that we looked at in the webinar is a state-level set of reports. It's the MAP Health Home Performance Dashboards. We went through these at during the webinar. We have no new information about it. These are fabulous reports that will give you wonderful comparative data at levels of detail that are extremely good in terms of being helpful to you in supervision. These are not yet available. It was anticipated that they would be available to you beginning in mid-August. They are not yet out there on MAP for you to draw down. So really, the information in this slide deck is the same information that was recovered in the webinar. And the bottom line is hurry up and wait. We think you will really find this to be extremely helpful information when it is available. So keep your eyes out for announcements from the Department of Health that these reports are now available, and they are available at the health home level, at the care management agency level, over various time periods for various data points. So you have something wonderful coming in terms of great data, but unfortunately it is not yet available to you.
And Adele, I see Tom had typed up, actually in response to the questions related to the MCO level data, and he's asking, can we be proactive? Should we be seeking this info by taking a particular action?
I don't know what action you might take that would get these reports available, up and available sooner rather than later. Actions. You could encourage your health home to speak up at, there are 2 health home learning collaborative meetings per year, at which the Department of Health seeks input from the health homes on what they might do better, what's coming up. Can you say more about why we will find MAP extremely helpful? So anyway, to finish the question, what can you do? Encourage your health home to keep asking about it in the learning collaborative. Why will this be extremely helpful? Here's an example. There is one report about emergency room utilization. You can look at the average rate of emergency room utilization for your agency's enrollees, compare that to the statewide average or to other health homes. So you can really rank yourself as to how effectively you are keeping people well in the community rather than needing to have emergency room visits. And you can see the performance of your agency against all of the care management agencies. You can compare health home to health home. So there's the type of information that you'll find in there. Other information includes your rate of moving people from referral to enrollment, and then the subsets of that, referral to outreach, and then the rate of outreach to enrollment. So it gives you some pretty solid information on items that have been identified as important to having successful health homes.
Great. Great. And I see Tom has one last question. Will all providers, such as medical providers contracted with the health home, also have access to MAP?
No, I don't think so. I think that in order to get access to MAP, you have to have a Health Commerce System account, which will then roll over into a MAP account. So I do not think that people outside of the care management agencies and the health homes would have access to that data.
Okay. Now I'm looking at the clock, and I know that we're just a little bit over, and I know some folks may need to be leaving this webinar for other commitments, but if you do have the time, we have one last polling question, and that is, as you know, Ruth had mentioned, next month we're going to be having 3 online regional meetings where we're going to talk more in detail about how is it going on your ongoing supervision of outcomes measurement. Is there anything in particular you'd recommend that we cover? Anything around how we can make these meetings most helpful for you? So if you have any of those ideas, please type them up now or shoot us an email at another point in time, because we do want to take your ideas into account. The other thing on your screen right now, you'll see a gray pod that has appeared, and it will allow you to download two documents. One is the PowerPoint from today, and the other is a list of HEDIS measures. So feel free to do those as well. And as folks are typing up their ideas for next month's regional meetings, I'm not going to read them necessarily, but we will keep a record of them, and we will certainly take them into account as we do our planning. And so once you've typed up and once you have downloaded, I think there's just one other slide I'll want to read if we can go to that slide.
Paul, I believe you have the ball.
Do I? Because I can't. Okay, now I can. Thank you. And it's the next steps. And I'll just read this to you. If you're joining the webinar as a group and did not get a chance to list everybody's name as you joined, please type the names of the people who are attending with you in the chat box so they get credit. Great, and you also see our contact information. So once you've done all these things, if you need to move on to some other commitments, feel free to do so. We want to thank you so much for joining us today, and we do hope that we've been helpful to you and that we so appreciate the sharing that you've all been doing with one another. It's been an active session today. Thank you very much, folks.